Good afternoon, Facebook peoples. Well, it may not quite be afternoon. Brian and I got a false start on a live on Facebook, so we're jumping back in, recording it over on Zoom, and we're going to drop it into Facebook in just a little bit. But we'll try to get all of your questions answered. So as I said, if you are in pain or you know somebody that's in pain, or you just have questions about some aches and pains you have, this is a perfect time to come and join Dr. Brian and I. I'm Judy Best with eXp Realty, and I'm just trying to bring you some people that would enrich your lives right now while you're social distancing. And so if you're watching this, drop me a line to let me know how you're doing, what kind of pains you're feeling, and any questions you might have about physical therapy or pain relief. Today, my guest is my good friend, Dr. Brian Murphy with Pinnacle Physical Therapy. And he and I did a video last fall together at his office, and that was so much fun. Brian and I had never met in person, and immediately we felt like we were brother and sister. We were laughing and joking, and it was so much fun that I was looking forward to having him with me today. So Brian, tell him about you and your practice.
Awesome. Yeah, thanks so much, Judy. We did really have a good time last time, and I'm looking forward to having another good time today and sharing some great information. So I am a doctor of physical therapy, and my practice is over in West Little Rock over by Izzy's restaurant. And I've been there now going on about 3 years, been in rehabilitation and sports medicine for 15 years. And really what I specialize in doing is in the practice area of orthopedics, which is joints and joint related pain. But really what I do is I help patients stay healthy and active, and I help them, if something is flared up, to help them get out of pain. But then ideally what I like to do with patients is keep them on a routine that keeps them healthy and active and doing the things that they enjoy, especially obviously right now during this time of social distancing and the coronavirus. All of us are being thrust into different lifestyles than we are used to. So this is a time where some could argue you're not going to have another time in your life where you have kind of less responsibilities. It seems like life in a way has gotten a little bit more simplified, just because we're not running around town and taking the kids here or having extra meetings or things like that. But with that comes challenges that I'm helping a lot of patients with currently through telemedicine or telehealth.
Tell us how that telemedicine is working, how that works with physical therapy. Because when we think of physical therapists, we're thinking about that table and we're hanging on for dear life while you bend us.
Yeah, exactly. That's a great question. I think one of the interesting things is that how effective a treatment with a physical therapist over a video format can be. It gives us an insight into your actual environment that oftentimes you are interacting in. So your home, especially if you're a worker who now is working from home, and maybe you're sitting in a different chair than you're used to, you have a different setup of your workstation. So this is putting extra stress on your body that I can visibly see and make some suggestions on how we can correct those things to make sure that you're not getting overuse related injuries or you're developing bad habits with posture and things like that. So a lot of times what I tell patients that I do best is I help them use their common sense. And really what that means is for different scenarios, it's just helping them maybe with suggestions on what are ways that they can start relieving their own pain, whether that's through activity modification or what can they do to start being a little bit more active, just depending on their situation that they're finding themselves in now.
Well, and I know when we had originally planned this for the spring, we had hoped to be out on a golf course for this live because you take care of a lot of golfers and people that are doing other type sports activities. Are you doing any golf telemedicine?
Yeah, I actually am. I've got quite a few. I've got a high school athlete actually up in Fayetteville that I'm working with on a consistent basis. Um, there's the spectrum of athlete that could range from an injured athlete who's not able to participate, all the way to athletes who want to become better at their craft.
Yeah, where they want
So
to.
really, yes, exactly. So really in telemedicine, and like I just call it a video physical therapy, there's an opportunity for me to help both of those individuals. And really that two-way interaction works really cool because I can effectively critique an athlete or even a person's movement to see if there's abnormal movement, whether it's provoking pain, whether it's limited in its range of movement, whether it's the quality of that movement is poor. So that starts to clue me in as to what are some of the things I need to prescribe for them to get out of pain, enhance their ability to do whatever it is that they're wanting to do. So it's worked out really well with some of my performance athletes to critique their program and enhance it over this time that we're all having to be inside. It's like a lot of patients, unfortunately, because of these concerns, maybe they were in physical therapy, but then you know, for good reason, they're wanting to kind of stay away, or they're wanting to just take a little break. But really, that's not the best thing when it comes to progression of your condition. We don't want to go backwards if you've already been seeing a physical therapist and now all of a sudden you're stuck at home and maybe you're just sitting around on the couch. Well, that's not helping you on the back end of this when hopefully this thing crosses, out of our lives, that we want to be able to get back outside and enjoy each other and enjoy our sports and activities, just like this thing never happened, because a lot of us are going to need some stress reduction techniques after this is said and done.
Yeah, no kidding. Absolutely. Do you work with all kinds of sports? I have a brother in Springfield who has it's called 417 Sports, and they have baseball and volleyball, I know, as part of their traveling teams. And my niece is one of the professors at Evangel College there doing football, volleyball.
Oh, cool.
So do you do all those different sports?
Yes, yeah, my background, I'm from Florida originally, and my background is in athletic training, sports medicine. So I graduated from the University of Central Florida, the Knights, and I worked when I was there with just about every sport team that they had. My last rotation was with the softball team, and I traveled with them and provided kind of injury prevention, rehabilitation for a variety of athletes, baseball players, track, golfers, crew, football. So really those experiences have allowed me to and understand the specific requirements of each of those sports, like the ones that you just talked about. Overhead athletes, typically the common injuries we see are shoulder related, are elbow related, are neck related, upper back. So knowing the requirements of those sports helps to, number one, create some programs to make those athletes more resilient and prevent injury. But then certainly on the rehabilitation side, you want to think about getting that athlete back to their prior level of function, if not even better.
Right.
So having that background in sports medicine is really important, because you need to have somebody that understands, well, this baseball player needs to do X, Y, Z. And if you're not working on that in rehab, you're really doing that athlete a disservice.
Wow, that is great information. I'm so glad I'm talking to you today. Um, what about some of the older people? They're talking a lot about us on the news right now, and I'm not loving being lumped in with the older people, but I am. But my mom is in Springfield, Missouri. Also, most of my family's in Southwest Missouri, and
Okay.
she asked me specifically about if you had any tips for dealing with pain of arthritis in hands and fingers, because she's dealing
And
with that a lot right now.
okay. Yeah, the arthritis, the conditions of arthritis, depending on what type. I mean, there's that. This is a caveat with, there's psoriatic arthritis, there's rheumatoid arthritis, there's, osteoarthritis, which is just kind of bony changes. So, you've got to take this with a grain of salt to be able. Each of those really has a specific kind of set recommendations based on some professional organizations, the American Rheumatology Association. But just a general rule, activity, a certain level of activity, oftentimes for arthritis, is actually indicated. A lot of those organizations have consensus statements that say, for instance, if you have knee arthritis or hip arthritis, or even in the fingers and hands, that a certain amount of activity is good, because we don't want those joints to stiffen up and lose their ability to work normally. So certain activities with the fingers and hands can be good to ensure that those joints are moving and can function the way we need them to. Um, so those are things to remember, even in our load-bearing joints like our hips and our knees. There's a strong consensus when it comes to osteoarthritis that activity and load bearing of those joints actually stimulates cartilage to grow.
Wow, that's good
Yeah,
information,
so
because we
so
tend to
do
stop when we hurt.
exactly right. Yeah, yeah, and oftentimes you think of low back pain. Back a long time ago, they used to tell you to just lay in bed and don't do anything. But now those recommendations have done a 360. They actually tell you to get up, move around, stay active, and to not just avoid every activity, because they know that the side effects of sedentary lifestyle and immobility are much more detrimental than actually getting up and moving around.
Yeah. Well, I think last time we were talking, I asked about this, and so I want to ask about it again because I want my audience to hear it, is many of our experiences with physical therapists have been as prescribed following a surgery. And I
Yes.
know that you do that, but at the time you said sometimes your services can prevent people from having to have a surgery. Can you talk about that?
Yeah, that's a great question. I think it's important for your viewers to know that in the state of Arkansas, physical therapists are actually direct access providers.
Mhm.
And what that means is that you can see a physical therapist oftentimes without having seen your physician first. So there is research to show that, especially for pain related and orthopedic related injuries, that having a patient see a physical therapist can oftentimes avoid medications, expensive imaging like an x-ray or an MRI. What's funny is that oftentimes, even if you do go to your primary care doctor, hopefully they're referring you to a physical therapist anyway. So it's kind of like you're kind of skipping a step that actually has cost implications to it and time implications. And a lot of insurance carriers are seeing the value in that, and they are covering those services that are provided on the front line by physical therapists. So it's a great option. I can't tell you how many patients I've helped, get out of pain, save a lot of money, avoid doing things that they don't want to do, which is, take medications, get injections, have a surgery. I think it's important for, like I said, the viewers in our community to really know that physical therapists are here to be a great resource to keep you moving, to get you out of pain, and to really just be a guide to a healthier lifestyle that keeps you out of these major scenarios where you're down and out and can't function, which nobody wants to do.
Well, are there any that you're giving over and over again to people as you're talking right now on telemedicine that you could share with the people that are watching this today?
Yeah, for sure. What I kind of thought, I was on another Zoom call actually with another group of physical therapists that I'm involved with, and what's interesting during this time now, there's kind of, we called it buckets of individuals that this lifestyle, this social distancing has really created.
Mm-hmm.
And you can think about, you know, my wife, for instance, she's spending a lot more time at home with the kids. We have a 2 and a 4-year-old, so she's picking them up constantly, running around. Yeah. So for that busy mom, it's making sure that she is using proper bending and lifting mechanics. I think one of the easiest tips is don't always put your child on the same hip as you're holding them, because that constant pressure of that stress to the one side can start to create problems, overuse type problems. So simply switching your child from hip to hip and making sure you're using proper lifting mechanics, bending at the knees, keeping your back straight, is a great tip for that mom that's pulling her hair out because the kids are running all over the place.
Great tip. Yeah.
Yeah, the other one is kind of the office worker who is now working from home in a different environment, new chair, new setup, they're not ergonomic anymore. Those people, my recommendation is don't stay static. Don't sit in that chair for 4 hours straight and then wonder why you've got a new backache. You've got to get up, even if it's just to go get a cup of water from the kitchen, if it's to go use the restroom. Don't sit for more than 30 minutes to 45 minutes before you get up and move around.
Well, and if they're using laptops, they can absolutely move to a standing height desk and stand up for a while and just keep moving around to different rooms of the house with their laptops.
Exactly. Yeah, it's easy to get stuck in that same position because we're just kind of, we're in a groove, we're flowing, but that's really, it's going to be problematic for a lot of people because they're just in poor postures, and that's putting stress on our body structures, which then causes pain. A couple other ones are like the home improvement guru, who's now like, they're rebuilding their entire house because they have all this extra time. And these folks, my advice to them is to pace your activity. Don't try to repaint your whole house in a day. Take a room at a time, take a break, expand the project out over a longer period of time so that you're not doing it where you're going to get an overuse problem because you just painted your entire house.
Right. Just moving the furniture and reaching up over your head to do things and stuff. And be sure you're using ladders that are the right height for the project you're doing. Huge. Yeah.
And even just saying,
3 buckets, or are there more?
There's 2 more. There's 2 more. Yeah. So you've got the other one I call your couch potato, which is they're the ones who are maybe their gym is closed and they're a little bit down because they're watching the news, they're stressed out, and they're not as active as they used to be. A day like this is perfect example of get out and at least walk. That's the American Heart Association recommends 30 minutes of aerobic exercise 5 days a week. So a lot of people aren't getting that, and we know that being outside can reduce your stress, can increase your heart health, which is a super important area. So that's my recommendation for the couch potato. And then finally, the person who was already in pain, dealing with something, and they're wanting to put it off. Oh, it's just going to get better. Truth of the matter, it's probably not going to get better. And telehealth is a super great option for that person right now to come on with me. I'm offering a free 30-minute telehealth consult.
There you
So
go.
they can get on with me. I can help them start to do some things that can get them a reduction in their pain, help them figure out what's going on, find out if physical therapy is right for them or if they need to go a different route. So right now, that's a great option. Don't wait, because we talked about you're going to not have more time once this thing passes. It's life going to start all over again. Yep, it's going to get busy. You're not going to. So now's a great time to do something about it, so that when this thing ends, we can all get back to being active, be outside, enjoy the weather. So those were kind of my 5 buckets and advice for each one.
That was great information. Now I know that as required, you are still seeing patients in the office and that you're doing
Yes.
it very safely. So a good place for somebody that's in pain to start is to call and set up that appointment for telemedicine, right? If you've never
Yes.
seen them before.
Yes, yeah, that's right. That is the best route to do it. There's a couple different ways on my website, which is www.pinnacledpt.com. They could go on there, and one of the tabs at the top is a contact tab. They can go on there, click on that, and kind of fill out some information.
Mhm.
I will then reach out to them and kind of either if they want to just chat on the phone, if they want to use that complimentary telehealth visit, that just gives me a better idea of what they have going on, so that I can then set up a interaction with them to start giving them some value. So either that through the website, or certainly a phone call to my office, which is 501-529-2010. They can even text me on that number, ask some questions via text. So those are, I think, really great options that a lot of people need to know about,
Right.
because there are people out there that are hurting right now, and that certainly doesn't make this situation any less stressful. If you're
Right.
sitting around all day in pain and then watching the news, that's like the worst scenario you could be.
Well, and I know if you can at least talk to them, you can see if
Yeah.
there's any way to relieve their pain without them coming into the office. And if it's absolutely essential, you can talk them through how you can offer them some pain relief in the office. Or
Yes, yeah, I'm being very selective at who I see in the office. I mean, really for my own safety and for the patient's safety. So, of course, using masks and gloves and sanitizing I've been like sleeping with this thing, which is sanitizing, washing with it. So, yeah, and my office is not a huge, I'm the only therapist here. So I don't see a large volume of patients in here. And the ones I do see, I'm hyper vigilant about asking about their symptoms. The CDC is the best website to go to for all your information about COVID-19.
yes.
The news can get a little bit hairy, but that CDC website has phenomenal information about how to keep yourself safe, how to keep your family safe, information about what's the latest kind of tips and guide as to what the happenings are. So that's a great resource, and I'm following all those to keep myself safe and my patients safe.
Well, we want you to still go home and your family be safe, because as you mentioned, you have your lovely wife, Chelsea, and your 2 little kids that are under 5.
Yeah.
So, we want to keep everyone safe. And I think this thing is, we're tired of it now. We're tired
Yeah.
of doing this, and we just need to do it a little longer, and we're going to be back to being so busy before we know it.
Yeah.
So tell me
And
something you did yesterday on Easter Sunday that made you smile.
that's a great question. Well, we have our 2 kids, 4 and 2, my son Kason and my daughter Adeline. So the night before, of course, we set up Easter eggs all over our house and the Easter basket. So our kids woke up at the usual time, 6:30, and we got downstairs before them, and we recorded them and their interactions running around the house collecting eggs. So I think one of the things that we all have to remember is that we're spending a lot more time, at least I have been, with my family, and that is a blessing.
Right.
And that really made me smile. And I'm staying real focused on being present with the people I'm interacting with, which is really my family and select patients. And I think that's helping a lot of people get through this. We have to remember we're all human beings and we're all going through this together. And the
Yes.
more we can support each other and be positive, that this will pass and we're all going to be better off because of it. Of course, it's challenging, but we're all going to learn and we're all going to grow and we're all going to be better and stronger people. So I'm excited for that time to come and just change it back up.
Yes, absolutely. Well, it's a little different at my house because it's just me and my husband. We've been together forever. It's been 40 years that we've been together, more than 40 years. And so now the big thing that I'm doing is I'm trying to make some of our meals in the home extra special.
Oh,
So
great.
that it's not just us making a plate and eating a meal over and over again. So
Sure.
I'm trying to do things to make our meals extra special. And Saturday we called a chef friend of ours and asked him to make one of our favorite appetizers for us, which is poblano pepper cheesecake.
Oh,
And
wow.
so he did, and that was the feature of our Easter dinner. And it just felt like we were eating in a nice restaurant because we had neither one touched it to make it.
Yeah.
And it was something that brought back good memories of date nights out at restaurants. So
Yeah, that's fantastic. Yeah, there are super fun ways. And I know we talked the other day and I know you were really bummed that you weren't able to be with your grandbabies. And
yeah, I miss my.
um, yeah, but I think, a lot of people, I think that's a fantastic idea what you're doing with your husband because, yeah, things can get, you know, it's just a stressful time for a lot of people, and doing those little things for each other, I think is really important during this time to kind of help everybody get through this together because we're all in the same boat.
Right. So we're going to wrap this up by saying if you are in pain or you have somebody in your household that is in pain, Dr. Brian Murphy is just a phone call away and or an email away, and he would love for you to reach out to him because I think it gives him joy knowing not only that he's relieving people of pain, but that with athletes that are trying to become the very best version of themselves, that they see a different way to move that might give them more success in their sport. So these are things. I know I have a friend who is a golfer and she's had surgery, and I know Dr. Brian is her surgeon, not her surgeon, her physical therapist. Got to get these words right.
Right.
And,
Yeah.
she's really happy with him. Brian, thank you for joining me today. Let's do this again soon, either in your office or in mine. Let's not do it separate from home if we can avoid it at all, okay?
Sure, for sure. Yeah. Thanks again, Judy. You're awesome. You're a light to everybody you interact with. So keep that smile because we need more of those right now for sure.
Okay. You guys have a great day, and we'll be back next Monday at 11:30 with Melissa Falinsky, and she's going to be talking about livening up your landscape in your home. If you hit it too hard working on that landscape, you may need Dr. Brian Murphy. So then you'll have to come back and watch to this again. Thank you guys for joining us today, and we'll
Thanks,
see
everybody.
you next week. Bye-bye.